Dear students, my name is Dr. Mushraf Fauzi, and in this lecture I will talk about other types of radiographs that can be used in orthodontics beside the routine radiographs, which are the panoramic and cephalometric radiographs. These radiographs are an extra type of radiographs that helps in the diagnosis and in the treatment planning, and they include intraoral radiographs, extraoral radiographs, which can be used for assessing the skeletal maturity, and the most contemporary types of radiographs, which are the three-dimensional radiographs. So first of all is the intraoral radiographs. They are easy to be taken and recommended for a specific region in cases where doubt remains regarding the clarity of panoramic radiograph. So you can see here in this panoramic radiograph, in this anterior region, the view is not very clear, especially in the canine premolar region. So for this reason, sometimes other types of radiographs, specifically intraoral radiographs, are recommended in these situations for the clarity and diagnosis if there is any defects. So the most frequently used views are intraoral periapical radiographs, bite wing radiograph, and occlusal radiograph. So the most widely used is the periapical radiograph and occlusal radiograph, and bite wing radiograph is rarely used or indicated in some cases. So when a full set of periapical radiographs was recommended before the advent of panoramic radiograph, this means there is an extra radiation that the patient might be exposed to. So usually this type of views are not taken anymore, so the full mouth radiograph is not taken anymore because of extra radiation, and it has been substituted by panoramic radiograph. So usually we take either anterior teeth radiograph, upper or lower, or the posterior teeth periapical radiograph. So periapical radiographs are ideal for the detection of anomalies related to the size, shape, and structure of the tooth. So in this case, you can see a dilacerated or curved root of the second premolar, which will definitely affect the tooth movement of this tooth. And you can see here we have abnormal root or abnormally sized incisors. So periapical radiograph is indicated to diagnose the case and see if there is any artifact or defect in the teeth. And also in cases of fusion of teeth, like in this case, or when we have a supernumerary tooth, such as in this case where we have mesiodens, which is a supernumerary tooth, usually situated between the incisors, and usually it causes a central diastema. So in this case, the periapical radiograph is a very useful diagnostic tool. So what are the advantages of periapical radiograph? First of all is low radiation dose. So you can see from the table that two intraoral oral films, its effective dose is 0.002, which is a very low dose. And this is an advantage of periapical or intraoral radiograph. And we have excellent clarity of the tooth and supporting structures, as you can see in these cases, and the possibility of obtaining a localized view of the area, like in the anterior region or the posterior region. A periapical radiograph has one disadvantage is that this type of radiograph cannot be used for uncooperative patients, which means that patients who have a problem or have a gag reflex and cannot stand putting the film inside his mouth for a few moments. That's why it's considered as a disadvantage of periapical radiograph. Bite-wing radiograph, they are seldom used and usually they are ideal for interproximal caries detection and interdental bone height. Like in this case, we can see the interdental bone height where the bone is resolved. So in those cases, we can measure the height of the interdental bone, and if it is decreased or reduced, then the amount of force should be reduced significantly when applied to the teeth. Occlusal radiographs are of special interest, especially when dealing with impacted teeth. We used to use these radiographs very frequently in many patients, especially in cases of impacted teeth, and they are used in patients who are unable to open their mouth wide enough for periapical radiographs, and they are selected in special cases. So, occlusal radiographs, they are usually used in the maxillary arch for assessing the root form of the incisors and the presence of midline supernumerary teeth and for assessing the canine position. So you can see here in this case, we have a bilateral impacted upper maxillary canines. So occlusal radiograph is usually useful to assess the position of the canine, whether they are palatally or buccally impacted. And also, they are useful in cases of assessing the presence of supernumerary teeth in the midline or the midline cases of midline. So sometimes in orthodontics, we use a special type of appliances called the myofunctional appliances. And those appliances, they have to be used before the maximum growth spirit. Usually the maximum growth spirit for females occurs before males between the age of 11 to 13, while for males is the age of 12 to 14. So the peak maximum growth spirit usually cannot be determined depending on chronological age, and some types of diagnostic tools for assessing the skeletal maturity is used sometimes. For these reasons, sometimes we need to take extra type of radiograph for assessing the skeletal maturity of the patient. So one of them is a hand-wrist radiograph. Hand-wrist radiograph is used in planning orthodontic treatment and is important to know skeletal growth. I mean the growth spirit. So when taking the X-ray for the hands, we have the epiphysis, and we can assess the size of the epiphysis during different stages, and each stage says something about the skeletal maturity of the patient. So when the width is increased, it means that we are coming or close to the growth spirit. Ossification also happens, and then there is a stage of capping, as you see here, capping of the epiphysis to the diaphysis of the finger, and the final stage is the fusion. When this epiphysis is fused to the finger, then it means that the growth is completed. So by this type of radiograph, we can assess the skeletal maturity or the growth spirit of the patient. So, for example, as you can see here, you can diagnose the skeletal age of the patient rather than the chronological age. So according to this radiograph, this is a 9 years old patient, and this is a 10 years old patient, and here this is a 13 years old patient, and we can assess if the fusion is complete, so the growth spirit is completed, and it's a way of diagnosis. The second way of assessing the growth spirit or skeletal maturity is the cervical vertebrae maturation method. So, because cephalometric radiographs are obtained routinely for orthodontic patients, this method has the advantage over the hand-raised radiograph that additional radiation exposure is not needed to judge the probable timing of adolescent growth spirit. And when looking to this cephalometric radiograph, so assessing the C2 cervical vertebrae number 2 and number 3 and number 4, according to the shape and the size of this vertebrae, we can assess the maturity, skeletal maturity, or the growth spirit of the patient. So you can see here in this radiographs and this diagram, it shows that C2, the size and the change in the size of C2 and C3 and C4. And we have 6 stages. The first stage, we are 2 years away from the peak of mandibular growth. And in C2, CS2, meaning stage 2, we are 1 year away from the peak, and in stage 3 we are less than a year, very close to the maximum growth spirit, which is the best timing for using the myofunction appliance. And C4 indicates we are between 1 to 2 years away, and more than 1 year when we are C5, and at stage 6, we are 2 years away from the maximum growth spirit. So these types of radiographs, they can be used definitely for assessing the skeletal maturity without the need for extra radiation when using the hand-raised radiographs. Finally, thank you for your kind attention.